So the year 2022 began with another variant of COVID-19, that is the Omicron variant. This variant wreaked havoc across many parts of the world, and in India too we saw a quite number of Omicron cases. Although right now in India, the cases have reduced, and in the past 2 years, it is the lowest that the cases of COVID-19 have come in. So another variant of COVID-19, that is the XC variant, has been detected in the UK. Around 600 cases have come up. In fact, it is the talk of the town in India as well, as the first case has been detected. So to give awareness on this, we have Dr. Srinath Shashidharan with us. Welcome, Doctor.
Another variant of COVID-19 has been detected in the UK. And reports have come in that this variant is a bit more transmissible than Omicron. So Dr. Rahija, first of all, could you tell our viewers as to what exactly the XC variant of COVID-19 is?
It is the same, the variant remains the same. I mean, if you ask me, the variant is the same, it's Omicron. It's only that there's a hybrid that is there, a new hybrid that has come in, which is called as XE, like the BA.1, BA.2. The predominant hybrid that we had was BA.2 was a predominant strain, and now we have an XE strain. We can't call it as a different variant per se, but it's a different strain that has come in, which is a hybrid between the BA.1 and the BA.2. And this is what has been seen across parts of the United Kingdom, China, and emerging evidence from different parts of the world.
Right, doctor. So, a lot of panic, a lot of things are going around that, this variant, as you said, it's not a specific variant, but, a version of the Omicron BA.1 and BA.2. So, should India worry at all? Are we looking at another wave?
All right. So, a while ago, we'd had a study that came out from IIT Kanpur that actually said that there's a fourth wave that is going to come out in the month of June, and it is going to last for 2-3 months until October. So that particular study has actually stirred the hornet's nest, and we all feel that we're going to get a fourth wave that's going to come in the month of June. However, we cannot deny the fact that there can be a possibility, but however, it is not a distinct possibility as of now. It is a possibility, a probability, not really a certainty. Okay, this XC variant is definitely more transmissible, but all said and done, when the BA.2 came in, that was called as a stealth variant. That was called the stealth variant, as the most transmissible variant that was supposed to be there. And what really occurred was we didn't really get into a wave, really speaking. When you say wave, we're really looking at hospital admissions, people dying, hospitals filling up. Like what happened in the second wave with the Delta variant. That is not what we saw here at all. We just saw people getting infected, becoming fine like a simple cold and cough. So in my opinion, even this XE variant, XE kind of hybrid, will also have the same course. I don't think that this is going to have increased severity, because it is just a combination of BA.1 and BA.2, which forms the variant, the hybrid called as XE.
Right, doctor. So what you mean to say is that, we cannot, of course, we cannot say that, a wave cannot come in. But, specifically talking about the XE variant, it just like Omicron, it is very similar to it. And hence, we saw a very limited hospitalization during the Omicron wave, if I can say so. So there's nothing to worry, and India shouldn't worry, not at all. They should be careful, but a panic situation should not be created.
Correct. So the panic situation should not be created in any way. See, there is also some reports coming in from the INSACOG last night that actually says that they are still looking at the genomic analysis of the same XE variant, and we are not very certain about the fact that this is really the XE in the first place. So we should not even push the panic button as of now. And you must understand that this is only a minuscule amount of the COVID that is there in the country as compared to what it was when it came to Delta. So let's take the example and put perspective of UK, where the maximum number of cases are being reported. It is only 1% of the total COVID cases.
Right.
So it has not even outnumbered the existing BA.2 variant that Omicron has. And that's the reason that we should probably not be very worried. Not only that, you must also understand that our country is very different in the population dynamics as compared to China and United Kingdom. Also with respect to the vaccination coverage, there have been so much differences between both that we can't compare what's happening in UK or China that's going to happen in India.
Right, doctor. Another thing that people might get confused regarding the XE variant, that recently WHO has put in some more symptoms in the COVID-19's official list. So, will the symptoms or the treatment differ from any of the variants of Omicron or maybe Delta or anything, or it will be very
that's a very important question. See, at the moment, the data is coming from a handful of cases concerning the fact that the number of cases in the world otherwise are so large that these particular XE variant is actually a very small handful. So from all those handful that we know of, we know that it kind of mimics almost very similar to that of Omicron, which includes something feeling like a common cold, a symptom like a sneezing, a sore throat, a scratchy throat. So if it forms the same kind of symptoms of Omicron, I don't think that we will get into the range of breathlessness, because you must understand that if the virus is actually replicating in the throat, it is less likely to get into the lungs like how Omicron did. Omicron did a lot of things to the throat. People did have sore throat, people did have cold, but it never got into the lungs. We've hardly had any cases getting into the lungs. So in that way, it appears that this Omicron will not change its symptoms per se. This variant will not change its symptoms from the regular Omicron BA.2 that we have.
Right, doctor. So, as of now, in the current situation, India should not panic, but they should just be aware. They should follow all the guidelines that the government is saying, should sanitize, wear the mask, especially in public crowded places, as doctor has advised. So, doctor, your last closing notes.
So, yes, life has to go on. We are going to see more variants. We are going to see more hybrids. But Darwin's theory should hold straight. As we go ahead, there is going to be a principle of evolution. These viruses are slowly going to die off. And yes, we are resuming normal life very soon, and we have done it so in a few cities in Mumbai already.
So thank you so much, Dr. Sanjeet Sasidharan, for taking our time and making the audience aware about the new XE variant. That is the talk of the town right now.
Thank you very much. Thank you very much.
Thank you, sir.